Let's go, it's Thursday. Woo, 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 woo. We just have 2 more days until the weekend, and it's 4th of July weekend, so you're looking at probably a 3-day weekend. So let's keep this weekend going. Welcome back to Everyday with Forcier. I am Miranda Forcier. This is the Forcier Fitness Garage located in North Natomas. I am a health, fitness, and life coach. I can train people in person. I can do it virtually, whatever your needs are, baby, I got you, okay? Today's topic, this is just a 5-minute video I do every day. Today's topic is gonna be about lower back pain, okay? This is a really big topic. It's one of the #1 issues most people come to me with, either back pain or knee pain, right? So I'm gonna give you 3 things that you need to know if you have back pain and how to prevent back pain. So first things first is posture, okay? So I'm gonna be doing a lot of demonstrating in this video. I'm gonna take my shirt off so that you guys can really see what I'm talking about, okay? So when you're standing, first of all, a lot of people tend to stick their butt out like this, right? And you have this arch. You kind of let your belly button go, right? A lot of people also roll their shoulders forward too. If you have a job that is sitting at a desk, you're probably doing this a lot, okay? So this is gonna, when you're rounded forward, you can see all of my muscles are stretched out. When I stand up tall, the muscles flex. So when the muscles are flexed, they're protecting the spine, okay? The reason why you have back pain is because your spine is not protected, and there's a good chance that you're probably throwing yourself around and you weren't able to really hold on to your spine and something got pulled out of place. The lower back also, when you push your hips backwards like this, you're compressing that lower spine a lot, right? Then you throw in some kind of a squat, and now your back is even more engaged and you're gonna hurt it even more. There's some really deep-rooted muscles right in here that connect your spine to your pelvis. Those are called your QL. They are very deep inset right here at the base, and they get really, really tight. So it's really important that you're watching your posture so that you don't hurt your lower back. And that can come from a lot of different things too. If you have tight hips, if you have tight legs, it's all gonna be pulling on that lower back. I tell people all the time, it's kind of like a rubber band, right? If you have a rubber band stretched out and you pull from the middle up, you're gonna have the ends come in, right? So it's the same thing as far as like your muscles go. So if this is your rubber band, right, you're connecting your knees to your hips and your quads are tight, you're going to pull up, and which is gonna pull on the hip and pull up on the knee. If it pulls up on the hip, it's gonna pull on the back, right? So there's a lot of things. Now some people, like myself, have what's called a tilted pelvis. So the pelvis naturally tilts forward. I have a lower back condition called retrolisthesis. So your spine is supposed to sit like this. Well, the vertebrae that connects to my sacrum here is pulled backwards. So that's why I kind of stand with a tilted pelvis, which means my QLs are always tight. A lot of people have this issue. A lot of people also have scoliosis, which I also have. So you're already kind of off to a bad start, which is why it's super important. Here's tip 2, or things to know too. Very important that you are stretching, okay? Stretching is so important. Here's a few stretches that you can do. First of all, if you have lower back pain, stretch your legs, because your legs are gonna pull on your back, right? So one of my favorite ones is just a hamstring stretch. And a lot of people are probably really tight in the hamstrings because you sit all day. So first of all, have your legs slightly bent and just hang forward, all right? The deeper the knees are bent, the more of a stretch you're gonna get in that lower back. Grab onto your elbows. You can shake your head no, and nod it yes, and that releases the tension in your upper back. And then to really get down into the lower back, you can bend just one of your legs and straighten the other, and really press that straight leg hip all the way up, even kind of tilt to the side. So here I am, all right? Straighten this leg, and I'm kind of twisting to my towards the bent leg, and then now that side of the back is getting stretched out, and then you switch, right, and kind of twist here. That's just one of many stretches that you can do, okay? But that's one of the better ones that I like to do, because you're getting a really good hamstring stretch and a good lower back. But there's so many more I can absolutely help you with if you guys ever need it. The third tip that I want to leave you guys with is stretching is only gonna get you so far. It is so important that you are seeing a massage therapist and a chiropractor on the regular, okay? So let me talk real quick about when you're exercising, your muscles tighten, right? Remember that rubber band? They tighten. And your muscles are connected to your joints. And so when your muscles tighten, it's gonna pull the joint with them, which is gonna make you out of an alignment. Massage therapy relaxes the muscle, but the joint is still pulled. You can't push the joint back in without chiropractic care. So I have tagged my recommendations for massage therapist and chiropractor below. If you let them know that you're one of my clients, they will give you a discount off your first time there. All right, so hit them up. Pike is my absolute favorite massage therapist. I've been working with him for years now. He's amazing, great guy, great massage therapist all around. And then my favorite chiropractor is Dr. Dan Oliver with Sacramento Spinal Specialists. They're located in Arden. Really amazing chiropractor who's also been one of my clients before. So he knows what kind of training you're going into. He knows how to adjust your wrists, your elbows, your hips, your neck, your shoulders, all the above. He doesn't give you just one of those quick adjustments in and out. He makes sure that you get therapy also. So he puts TENS units on you and you sit on this rolling table so you get nice and ready for the adjustment. You're not just going into the adjustment stiff, right? So get in with a massage therapist at least once a month. Get in with your chiropractor at least twice a month. If you guys need any help, I can help you with creating a fitness plan that works around whatever injuries you have to help prevent injuries from coming back. I can also help you with a stretching schedule, and I can help educate you more on massage therapy and chiropractic care so that you don't have any more of these problems in the future. If you guys have any topics that you want me to go over in these Everyday with Forciers, put them in the comments below. Otherwise, I will see you guys soon. Thank you and have a wonderful Thursday.